There are millions of Americans who can't afford to see a dentist right now. It's a crisis that started well before COVID, but the pandemic is only making things worse. Chris Conti takes a closer look at why doctors are so concerned and how some are stepping up to help.
If a smile changes everything, you can understand why Anna Eubanks cares so deeply about her teeth.
Because that's part of my health, you know. That's part of your health.
But affording a trip to the dentist is often as painful as a cavity. Both Anna and her husband are among the millions of Americans who do not have dental insurance.
You do think about it. It's just you hope you never have to go there, that you never have to use it.
There were great disparities that existed in the American healthcare system long before COVID hit. The last few months have only made things worse.
You think you can put it off, and it just catches up with you eventually.
Dr. Rhonda Switzer Nadassi oversees Interfaith Dental in Nashville, Tennessee, a nonprofit made up of dentists who volunteer their time so that people like Anna Eubanks can get care at little or no cost, a need more critical now than ever.
So there's new groups of people that, they were making it before, but they were right on that edge and are now struggling.
Here's why she says that. Since February, an estimated 12 million Americans have lost their health care coverage. Most lost their insurance when they lost their job. Compare that to the number of people without dental coverage, which is now closer to 40 million.
COVID exposed further. We are all in this together. Your health affects my health.
This clinic that typically sees about 3,000 patients a year has seen call volume increase 20%.
And we're also seeing such an increased need from people that are suffering from job loss, where they may have had 3 jobs and are now down to 1 or are down to none.
Nationwide, there's also a backlog for dental care.
Is this symptomatic?
In this office alone, they were canceling 1,000 appointments a month during the shutdown, something that especially worries Dr. Switzer Nadassi during COVID, because most dentists are also checking a patient's overall health.
Most of the people that come see us don't need just a checkup and a cleaning. Most of the time they have reached the end of their rope of trying to find services, and what they need has become critical.
But for now, they are doing their best to help whoever they can and preserve as many smiles as possible.
It's kind of like the weather. You have to adjust yourself for that, like you got to adjust yourself to God's weather.
In Nashville, I'm Chris Conti.